Welcome to this video about acne, a very common skin condition. Acne often improves by the early 20s, but severe or persistent cases can continue into adulthood and may lead to permanent scarring. Early recognition and appropriate treatment are vital. The development of acne is driven by 4 key factors. The first is androgen-mediated seborrhea, which causes excess sebum production in the pilosebaceous glands. The second factor is comedone formation, also influenced by androgens, resulting in open comedones or blackheads and closed comedones or whiteheads. The third factor involves colonization of the pilosebaceous unit by Cutibacterium acnes, which contributes to inflammatory lesions. The fourth and final factor is inflammation, which significantly influences the progression and severity of acne lesions. Several factors can influence acne severity, including hormonal changes like premenstrual fluctuations and endocrine disorders such as polycystic ovary syndrome or PCOS. While the role of stress in diet is debated, some evidence suggests that low glycemic index diets may help, while high glycemic foods might worsen symptoms. Topical factors, like oil-based cosmetics, can exacerbate acne by blocking pores. Additionally, certain medications, including systemic corticosteroids, anabolic steroids, and lithium, are associated with acne. Clinical features of acne include greasy skin from excess sebum and comedones, which are blackheads and whiteheads. Inflammatory lesions such as papules, pustules, and nodules are also characteristic. In more severe or long-standing cases, scarring can occur. Post-inflammatory hyperpigmentation, particularly common in individuals with darker skin tones, can persist even after active acne has resolved. Acne is usually diagnosed clinically. However, in women with signs of hyperandrogenism, such as excess hair or irregular periods, PCOS should be considered and investigated. For comedonal acne, the preferred first-line treatment is a topical retinoid, such as adapalene. This is often used alone or combined with benzoyl peroxide. Azelaic acid can be beneficial for patients with darker skin, where acne often leads to hyperpigmentation. Initial skin irritation from topical treatments is common. To improve tolerability, introduce treatment gradually, starting with short contact times and limited frequency. Note that benzoyl peroxide may bleach fabrics. For predominantly inflammatory acne, treatment should include a topical antimicrobial agent, like topical clindamycin or erythromycin, often combined with benzoyl peroxide or a topical retinoid. If topical therapy is insufficient, consider adding a systemic antibiotic. It is crucial not to co-prescribe topical and oral antibiotics due to the risk of antimicrobial resistance. For instance, oral antibiotics can be combined with adapalene and benzoyl peroxide, but not with topical antibiotics. Tetracyclines are often first-line systemic agents, typically prescribed for 3 to 6 months. Other options for women include combined oral contraceptives with anti-androgenic progestogens, like drospirenone. However, be aware of the increased risk of venous thromboembolism. Spironolactone, an anti-androgen, may also be used in select patients, though results can take up to 6 months to appear. For patients with severe acne, nodulocystic lesions, scarring, or those unresponsive to standard therapies, an oral retinoid like isotretinoin should be considered. Isotretinoin treatment is usually initiated and monitored in secondary care, requiring careful monitoring of lipid profiles, liver function tests, and urea and electrolytes. Women of childbearing potential must receive strict contraception counseling, as isotretinoin is highly teratogenic and poses a risk of severe fetal abnormalities. For acne scarring, milder or early scars may improve spontaneously. Persistent or noticeable scarring can be treated with laser therapies, intradermal injections, or surgical techniques. Hypertrophic and keloid acne scars can be managed with silicone products, potent steroid creams, fludroxycortide tape, intradermal triamcinolone injections, or pulsed dye laser. Remember to use a non-comedogenic moisturizer and ensure broad-spectrum SPF protection. Moisturizers with niacinamide may also help reduce redness and even out skin tone. Thank you for watching this video. Please like, share, subscribe, and turn on notifications for more content.